This session is part of the Animal Emergency Care Center's BHAG training. Do you remember what BHAG stands for? It stands for Big, Hairy, Audacious Goal. In other words, it is our envisioned future. The envisioned future for animal emergency care centers is to be the model. How much of animal emergency care center history do you actually know? Do you know its original name? Do you know when it started? Has it always been 2 facilities? When did the specialists get involved? Has it always been this size? Where is it going? And now part of our history for you to know. You might wonder why there's a photograph of Jamie and Sarah at their wedding in July 1994. This whole process started actually in late 1993. Jamie was a young faculty member at Colorado State University, not sure whether he was going to survive or like being an academic veterinarian. And as an anesthesiologist, the original practice was animal emergency care at North Nevada and Dublin. In 1994, there were 2 full-time veterinarians, and veterinarians worked 7 days on, 7 days off, 6 p.m. to 8 a.m. Monday through Thursday, and 6 p.m. Friday until 8 a.m. Monday. That weekend was a very long shift. In 1995, Christy Cheveria joined Animal Emergency Care. This is a picture of her with Sasha and actually putting together one of Sasha's stuffed animals. "1996 saw us growing in spectrum of practice. Sasha basically grew up at the emergency clinic since Jamie and Sarah were there on many weekends. As we continued to grow, Dr. Mike Bauer left the university as a surgeon and opened up a private practice in Colorado Springs. Initially in 1996, he did his surgery and saw his appointments out of the shared space with animal emergency care. In 1996, we also had other specialists seeing patients out of our facility. Dr. Dugan, an ophthalmologist, would come down from Denver and use our facility. He has since built his own facility in Colorado Springs. And we had 1996, we actually added overnight staff. This clearly is not the staff from 1996, but it's indicative of how we were growing at the time. Soon after purchasing Animal Emergency Care, the other veterinary practice that was practicing emergency medicine, Animal Emergency Center at Union and Pikes Peak, approached us about merging. Of course, it took about 1 nanosecond to realize that we did not want to be partners with 24. With Animal Emergency Care and Animal Emergency Center merging and a new staff, we decided we should have a new name and became Animal Emergency Care Centers. We went from 2 doctors to 4 doctors for both practices, and then very quickly went from 4 doctors to 6 full-time doctors as the emergency practice in Colorado Springs got busier and busier. We also expanded our staff again to accommodate the increased level of care that we were trying to provide. In 1999, Dr. Chris McReynolds finished his internal medicine residency at Colorado State University and came down to Colorado Springs, and like Dr. Bauer, started practicing out of our small facility in Colorado Springs. In an attempt to make the internal medicine practice more viable, we decided to try 24-hour emergency care at the same time. Initially, Dr. McReynolds was seeing daytime emergencies along with performing internal medicine, but as internal medicine got busier, we hired Dr. Melanie Marsden, who's now at Pikes Peak Veterinary. The original facility at Pikes Peak and Union, where Animal Emergency Center was located, was tiny, about 1,200 square feet. In the year 2000, Lakewood Veterinary Clinic . In 2001, Dr. Bauer, Dr. McReynolds, and their staff moved next door to us at Animal Emergency Care on Academy Boulevard. So now we had our facility back, but we were providing overnight care for their patients when needed. The facility at Academy in Dublin had been in use for quite a long time and was getting pretty run down. So in 2002, we did a major renovation of the Academy Boulevard Hospital and expanded to 3,500 square feet. It was really quite a good renovation. The place looked new, clean, new floors, cabinets, paint, and this renovation in 2003, there were some outside influences and challenges, opportunities, and threats that were occurring in Colorado Springs. Drs. Bauer and McReynolds had decided to start in April 2003, after Jamie visited with Mike and Chris in Colorado Springs and coming back to Fort Collins. He and Sarah sat down at Starbucks for a 45-minute conversation on a Sunday morning. And during that conversation, they had decided to move to Colorado Springs in 5 years, then in 18 months, and then in 4 months. So in April, it was decided that Jamie and Sarah and Sasha would make the big move. And after coming to Colorado Springs, some new things started to occur. There was a more direct, hands-on leadership and management of Animal Emergency Care Center. Hemo Solutions Animal Blood Bank was launched, and in 2004, it became apparent that the South Clinic needed to be renovated again. It looked like an aging 1970s building made out of concrete, and so it got a facelift and some new cabinets and renovations